As the number of coronavirus deaths in the U.S. surpasses 50,000, people across the country have been unable to hug or hold their dying relatives because of visitor restrictions at hospitals. And that's where my next guest steps in. In New Jersey, this patient advocate has been facilitating FaceTime calls so that relatives can see and speak to their loved ones. His name is Wojtecki, and he's the Assistant Director of Patient Experience at Clara Maass Medical Center, and he joins me right now. Joe, this is, such a kind deed. It really is a gift for so many loved ones, families. What inspired you to do this?
I started working at Clara Maass about 15 years ago, and the patient is the center of everything we do here at Clara Maass Medical Center. And I have to say that when I was asked to FaceTime the family member, it was natural for me. I just went into the room, we connected, and it was a bond that needed to be happening.
And then describe what has happened. What have you been witness to see these are the last word sentiments being exchanged by loved ones?
It's touching that when you're in that room and you have the opportunity to connect with somebody who is either passing away or it's their final moments, or someone who can't come into the building because of the COVID-19, and that I'm there as a vessel to connect with those loved ones. It's amazing.
Yeah, it has to be amazing. And this is so personal. It's such a personal moment. And, what is it like for you, to be in such an intimate setting and to see, this intimate moment being shared by, loved ones, and in many cases, a dying loved one?
It's difficult. It really is. Yeah. I'm there. They're sharing the last moments together, and I'm in the room, and I'm watching family members express to each other how much they love each other, and that they wish that they could be in the room, and they can't. And it's very emotional. Yeah. It's emotional for the family, and it's really emotional for me to be in that room and sometimes touching the patient for the family members and just sharing those last moments. It is emotional.
Yeah, and how do you, keep it together, so to speak? I mean, it's not that you've done this one time, but multiple times. And as you just described, and I can hear your voice change, how emotional it is for you. How do you manage all this?
There are days that they are trying days, but I get through it. I have a good support system. I go home, I talk with my family. My boys are always there for me. I have 3 boys. I have a sensational leader, Mary Ellen Klein, the president of Clara Maass Medical Center, extremely supportive. I have a great support system. My partner, Tanya Manigo, we all get together. My director, Javier. We're all doing it together. Everyone from patient experience, the nurses, the nurse leader, we're all working this together. I'm not the only one. We're all out there together.
Yeah, you have an amazing team, and I hear the response coming from families has just been through the roof. What have you heard about how they feel about, this gift that you are helping to extend?
It is, when they come in the front door and they ask, please let me go upstairs and just say goodbye to my family members, to tell them no is difficult, and say that, we have this opportunity where I can go upstairs and I could use a virtual tool where I can have you either FaceTime or Duo with your loved one. It does work out. It's not the best way, but it is a way. It's the safest way.
Yeah. I know these family members feel like they cannot thank you enough, but really, I'm serving as an extension, for them, just to thank you for all that you and your team are doing to allow these families this intimate, very special moment at the most tender time of their lives. Joe Wojtecki, thank you so much, and thanks to your team. Appreciate it. And thanks for sharing it with us.
Thank you.